Thank you for joining us today at our live sessions by Medcare. Today we have Dr. Ahmed Shinoufi, consultant urology at Medcare Hospitals. Our topic today is very interesting. It's about kidney stones. So I encourage you to please send us our live questions, and I'll be more than happy to pass it to the doctor and answer it. Dr. Ahmed, how are you?
I'm fine.
All good?
Thank God.
Perfect. Dr. Ahmed, today's topic is about kidney stones.
Yes.
So if you can take us through what is a kidney stone, the side effects, how it came, and how the body can, form
Okay.
the kidney stone.
Kidney stones is a group of crystals sticking together like cement in bricks and forming a small stone or a big stone. Accordingly, it usually forms in the kidney, then it can be at any site in the urinary tract. Usually there is a cause in the body that helps in stone formation. One of the important theories in stone formation is supersaturation. What's meant by supersaturation? If I have high calcium in urine, for example, high uric acid in urine, high oxalate in urine, the crystal that forms stones, it gives me more chance for these crystals to precipitate. If they are higher than normal, you have a more chance for these crystals to precipitate and form stones.
Can someone be born with kidney stones?
Yes, even in young age, we noticed that some babies and some small children have kidney stones, but usually they have metabolic defect and may be born with a metabolic defect that makes them form stones. We see it in children, yes.
But this is not something that they formed during maybe a breastfeeding from the mother, something that passed to them from the mother's milk?
Usually not from breastfeeding, but usually it's an inborn error in their metabolism.
And doctor, what is the age that usually patients would come to you with kidney stones?
In the 30s, 40s, 50s. It's a wide range of age. People can come at any age complaining of stones. It's very important to know when to visit a doctor and search for medical help. It's very important.
Okay, and is there any different types of kidney stones?
Yes, there are many types of kidney stone. The most common is calcium stones, or especially calcium oxalate stones. Other calcium stones, these are about more than 70% of stones. Then we have uric acid stones, cysteine stones, trovide stones, a lot of stones, but they are not as common as calcium stones.
Doctor, since we promoted the session on social media, I've been receiving a couple of questions regarding how can we treat it? And before the treatment, what is the signs that a person could get and say, yes, I do have a kidney stone, it's time for me to go to the doctor and check it?
It's very important to suspect a kidney stone when you have a pain in the line like that, radiating towards the genitalia. It's very important. Sometimes it's accompanied by nausea and vomiting. You have tendency to vomit or so. Sometimes fever. Or sometimes the symptoms are in the urine itself. You have some difficulty to pee, some pain during peeing, change in the color of urine. If you have any of those symptoms and signs, you should consult a doctor because early diagnosis of stone makes the treatment easier. When you go to the doctor earlier, this means that you will have easier treatment.
And what would the patient expect from the first visit to the doctor?
First we do a clinical examination. We make sure that this is from kidney stones. Sometimes the pain is from other things. He may have appendicitis or anything in the abdomen. So we make sure that this pain is really from the kidney. Second thing, usually we do a urine test because sometimes presence of blood cells in the urine is indicative that he may have a stone. We assess the kidney functions to make sure that the kidney is okay and nothing is problematic. And usually we do at first ultrasound. Ultrasound, we do it as a screening. If you have a stone, usually you have an abnormality in the ultrasound, and this may necessitate more investigation. If your ultrasound is okay and urine is okay and kidney function is okay, usually it's okay.
And does it stop at the ultrasound, or they could take it onto blood tests?
Yes,
and...
we usually go after that for non-contrast, we call multi-slice CT, a special type of CT to detect stone. Why? It's much more sensitive. It can detect more stone than ultrasound. But sometimes we start with it, and if we have high suspicion of stone, and sometimes we just do an ultrasound to see. If the patient have abnormality in ultrasound, we can shift to do a CT.
Doctor, if you can try to help us imagine the size of a stone. So is it like it varies different sizes? If it's a small one, then we can wait and keep it in, and then we can flush it through drinking water, for example? Or
yes, a lot of stones, a very huge number of stones are very small, and the medical treatment is very good. What I advise people when they go to the doctor early, we not necessarily do him an intervention. Sometimes we tell him that you can take medical treatment, you can drink a lot of water, we can give him some medicine to help him to flush the stone out. So we can do that. Usually, most stones are few millimeters and they can pass. Sometimes we help this passage by some medications that help the patient to pass the stone more. And actually, the big number of patients can go for medical treatment, but controlled. And one advice about medical treatment, many patients, when they take medical treatment, they don't follow up. It's very important to make sure that you are cleared from the stone.
Course and,
because if I left a small stone, it may grow and become bigger, or I may form another stone. So it's very important to go to the doctor after finishing the medical treatment and make sure that you already passed the stone. He can do your ultrasound, whatever. If you pass the stone, very important to go to the doctor to analyze the stone and know what is composed from, because every thing it's composed from, we can give you a treatment or a prophylaxis to avoid avoid recurrence of the stone, and you have more stones. Many patients may form a stone later. If they already formed the stone, they have higher chance within 5 to 10 years to form another stone, especially if he has a metabolic error.
But how can a doctor or the lab analyze the stone? I mean, it would just be passed in the urine. So
if it passed in urine, we send it to the lab. It tells us it's calcium, for example, calcium stone.
Okay.
So we search what are the causes of calcium stone 1, 2, 3, 4, and try to find what caused the stone in the first place. Sometimes we are not sure of that. Sometimes we can find a disease and we can treat it. For example, problems in the parathyroid responsible for calcium, the patient may form stones a lot. And if we don't deal with the primary cause, with the main cause that caused the stone formation, he'll have more stones and more stones. So we must treat why he had stones. It's very important. We can take it into 4 steps. 1, we manage the pain or the symptoms the patient has. Second, we can manage the stone itself, either medical, endoscopic, surgical, whatever the management is. Third, we must treat the underlying cause. What caused the stone, and we can deal with it. And that's why assessment, a group of labs to check what formed the stone is very important to do. Number 4, prophylaxis against recurrence of the stone. And the very important thing, drink a lot of water. Drink a lot of water.
Which we don't.
Always the urine towards the colorless color, not the yellow, deep yellow color. Always try to be colorless. Always drink, especially during the day. Drink a lot of water.
The questions that we started receiving is drinking a lot of water prevents kidney stones, and what about water toxicity?
Water intoxication is very rare. You have to drink a lot of water, not the normal thing. What I advise is drink by the clock. Every 2 hours, have a small cup of water. This will hydrate you well. Don't drink it in one moment. Just throughout the day, you are drinking water. You are trying to make your urine dilute. When your urine is dilute, it's not 100% you will not form stones, but definitely you have a lower incidence of forming stones. And if you form stones, they will be smaller. When you drink a lot of water, it's very useful to you.
Another question, can I buy medicine over the counter, and what would that be?
It's very important to consult a doctor. Some medicine are herbal. They are theoretically, they don't harm you. But you should consult the doctor. Is it, I'm eligible for medical treatment or not? Because sometimes when you delay, you harm the kidney. Sometimes even in small stones, there's abnormality in the urinary tract. There's low incidence that stone will pass. So earlier intervention will be better. If there is infection in the kidney, you must deal with it. If there is obstruction in the kidney, you must deal with it. It's not the matter of the stone is small, so I'll take some herbals and finish it. If you consult the doctor, he will tell you, you are suitable for medical treatment, you can take it. And you can try any herbals, it's okay. As long as they are safe and you consulted the doctor about them, you can try any herbals to this job. But the important thing, am I indicated for this type of treatment or not? This is the important thing.
This is a very important point for sure. Another question on the color of urine can detect kidney stone. You mentioned there is difference in the color.
But sometimes the color of urine is important, especially if it's reddish in color, taking the dark color. It may indicate that maybe there's some blood cells in the urine, because it's not necessary to see the blood. When you have blood cells in the urine, less than a certain number, we call it microscopic. It's only seen under the microscope. You will not see it. So change in color of urine is very important. And I advise, do a urine analysis at that time, before the urine clears, to know, am I having blood? Am I having infection? Am I having anything? When you find that your urine color is not normal, do a urine analysis as soon as possible.
Okay, good point. Is kidney stone treatment easy? I heard a technology called waves.
We have a lot of treatment to kidney stones. First, the medical treatment. Endoscopy, we do a lot of endoscopy and very few open surgeries now. Endoscopy, we can go from the urinary tract downstairs. We can go from the kidney itself. According to the stone, the size, the location, if there any abnormality, we have to deal with it with the stone or not. Because some stones are formed not because the drainage of urine is not okay, because there is obstruction downstairs. So the stone, if you have stasis, the urine is not moving smoothly, you may have higher chance for precipitation and stone formation. So we must deal with that.
Doctor, not treating a kidney stone in the right time, what's the consequences, or what could happen?
Yes, what's important about that, I want to advise every patient, sometimes you are not complaining of pain or anything. So you are not interested in treating your kidney stone. But the more you keep the stone, the more the chance it causes infection in the kidney. It causes sometimes obstruction in the kidney. And on the long run, it causes damage of the nephrons of the kidney. We have a high reserve of nephrons. We have a lot of kidney cells. And that's why sometimes I don't observe that I have disturbance in my kidney function. Okay. But definitely leaving a stone for a very long time is harmful to the kidney. You have to get rid of the stone as soon as possible. And that's why I said you have to check after treatment that you passed the stone.
So is it about time to speak about surgery now? The one word that people don't like to hear.
Usually people do not like surgeries, but as I said, we don't have a lot of open surgeries. Most of the operations are done through the endoscope. It's easy. The patient goes out of the hospital same day or maximum next day. Little side effects. So I ensure that treating a kidney stone is much easier than before. Definitely, it's much easier. We have a lot of things. We have laser, we have shockwave lithotripsy, breaking the stone from outside the body even. We have a lot of options, and you can discuss with your doctor about what option is suitable for me. And you can choose. It's very easy, and you should choose.
Again to the treatment. So during the treatment phase, would the person be less active? Does it affect his activity? Or I get a lot of questions about running, and you get pain during running or walking for a long time.
Usually, I advise the patient walk, run, move a lot, especially if I gave them medical treatment, because stone expulsion is more with activity, with jumping, with running, jogging, etc. So I advise them, and
Regardless
usually
if there's
after
pain.
endoscopy, second day or third day, he can move, and no problem. If he have mild pain due to a stent, for example, or after treatment, we can give him painkillers for a few days, and he will be fine.
Painkillers. Do you advise patients to take painkillers during treatment? Regardless of what the treatment is, but do they take also painkillers?
In stones, in other indications.
You leave them with their pain.
If you have back pain, I don't like painkillers at all. The less you take them, the more it's more healthy for you. Because especially things like diclofenac, I don't want to say trade names. Things, anti-inflammatory medicines harms the kidney, and we have seen a lot of problems with that. Especially, I worked in renal transplantation for years. Sometimes you can have an insult to the kidney from anti-inflammatory medicines, especially. So I tell the patient, if you have pain and pain is increasing, take the medicine. If you don't have pain, don't take any killers. But upon need, the less you take them,
the better.
The better. And if you have recurrent pain, we call it non-compliance. He's not complying with medical treatment. So we can shift to another treatment. Instead of taking, for example, painkillers for a long time, it's better to choose an intervention and get rid of the stone. Don't take a lot of painkillers. It harms the kidney a lot.
This is a very good point, doctor. So if you put a patient on treatment, after a couple of sessions or visits, do you feel that you could change the treatment into something else if it's not working?
Course.
You can do that.
Of course. Because nothing is 100%. When I give, for example, especially medical treatment, I'll tell him, we can try medical treatment for 2 weeks or 3 weeks or so. Then we'll assess. If you are past the stone, it's okay. If you didn't pass, there's something wrong. Sometimes when we do endoscopy after the medical treatment, we find that the ureter is tight under the stone, and that's why it's not moving. Some patients have stone with a spike. It's inserted into the tissue of the ureter, so it will never pass. You have to take it out of the wall of the ureter, then slide it down. So sometimes it's not 100%, and you have to change. And that's why follow-up with your doctor is very important.
Doctor, another question regarding the gender. So do you see patients more on the male side or female, or that it's
male sides are more common. I see more
and
males.
This is because?
Maybe the metabolism will affect that. The different metabolism in males and females.
When a patient go and do like the vitamin test, so they can see their level of vitamins, would something like this indicate in the report that you are prone to get kidney stones because one of the vitamins level are higher or low?
Not essential, but taking a high dose of vitamin D may precipitate stones, and that's why when someone taking vitamin D,
what's the high dosage? Because I am taking vitamin D personally.
Not a specific dose, but high doses of vitamin D is associated with more chance for precipitation. And remember, everybody are prone to stones or not. If you are more prone, you can form stones. If you are not prone, even taking vitamin D will not affect you. But I ask them, just check with the doctor. Don't take vitamin D without doctor prescription and on your own. You should follow up every few months and check your blood level of vitamin D. Don't take it because we call it, it's not a water-soluble vitamin. ADEK, A-D-E-K, we call them fat-soluble vitamins. And we can have problems when they are high as well.
Okay.
As well as if they are low. So we must check if the indication of taking vitamins stopped, we can decrease the dose, we can stop according to the doctor advice.
Doctor, kidney stone can be genetic?
Yes, there's genetic diseases that precipitate kidney stone, like familial cystinuria, problems in the kidney itself. Yes, yes, of course,
So
it
if I
can be
have
genetic.
like a family history, this is one of the things that I should
Family
raise it to the
history is an
doctor.
important risk factor and should be addressed. Always check yourself, even every year. And when you feel the slightest symptoms are a blessing from God to make us go to the doctor and see what's wrong. Even a simple symptom can be indication of something serious.
Sure.
So you have to check yourself. You have to consult a doctor to say, sometimes he says everything is normal, go home and stay safe.
Okay. Doctor, if I go back to what we used to hear, and there's some certain food that could cause kidney stones, and we have this, back in our
Yes.
culture, there's like some kind of fruits, if you eat a lot of it, it will generate kidney stones, like teen and
of course,
this family of...
we have food rich in oxalate, food rich in uric acid, and you can see that on the internet, everything. But my advice, don't stop this food. Just take it lower dose with high intake of water. If you want to take this food, okay. But moderate dose, yeah, for example, for uric acid, don't take a lot of animal proteins. Just reduce the amount you are taking and drink a lot of water to make this crystal more dilute, to avoid the saturation of urine. This is what protects you.
Okay, so when we talk about those kind of foods, is that like certain food that they are higher that could cause the kidney stones that we could highlight, for example?
Yes, there's nuts,
Nuts
spinach.
can do that. This is new to me.
Sometimes some people say it's low, but nuts, red meat in uric acid stones, liver, shrimps, some seafood are rich in uric acid as well. So that's why it's important to analyze the stone, know what stone I have.
Okay.
So I cannot prevent you from all the food. If I stopped all food, I'll die. so I must just control your food, high amount of water. This is my advice.
Patients with high uric acid level, they're prone of getting kidney stones?
Yes, they should control. Uric acid does not form kidney stones only. It affects the kidney. It causes inflammation in the kidney and harms the kidney. And that's why you should reduce your uric acid level. If it's not controlled with diet control, we give something to help the uric acid level to get lower, and usually it's very effective. In most people, it's easy to take your uric acid level down.
Doctor, amazing tips. And before we close the session or end our session today, would you like to gather most of the tips that you have said now to the patients or non-patients, actually, something to avoid getting kidney stones? And when it comes, you mentioned the treatment, you mentioned the early treatment, you mentioned how can we prevent from getting it. But any other tips you'd like to add?
Drink a lot of water again.
Which, again, we
if
don't do.
If you felt anything wrong with your urine, pain, etc., you have to go to the doctor. Not necessarily he will do you something serious. We can do just ultrasound and urine test and check everything. And if you have a problem, treat it. And if you go for medical treatment or herbal treatment, you must check after that the stone is cleared and you don't have a stone anymore. Don't leave the stone for a long time. It will harm you.
Dr. Ahmed Al-Shenoufi, a consultant urology at Medcare Hospital Sharjah.
No.
Thank you so much for your time. We really appreciate the tips, and thank you so much for sending
I'm very
your
happy
questions.
to see you.
It's perfect, actually, and thank you so much for sharing your questions. I hope that we were able to answer most of them. Until next session, take care and stay healthy.
Thank you, Ala. شكرا لك.